So let's get started with the presentations. The first panelist who will be speaking for us today is Barrak, who will be outlining the health impacts of fossil fuel use, focusing on air pollution and climate change. Over to you, Barrak.
Thank you so much, Zara, and I'm very happy and excited to be part of this panel here. Let me just give it my presentation to be on screen now. Okay. So I'm going to talk about air pollution, climate change, and health, and mainly focus on the health part, and the taxes part will come later with the other panelists. So when we talk about air pollution and health, and we specifically, just to set the stage, when we are talking about fossil fuel combustion, many people would focus on the carbon dioxide that comes out as a byproduct, which is the greenhouse gas, but there are a number of gaseous and particulate pollutants that are important byproducts from fossil fuel combustion. Of interest is the particulate matter, which has been extensively studied in the epidemiological research. This is all what you can see here is one particle from fossil fuel combustion. Now, let me tell you, it is a number of carbon cores. They're all agglomerating together, but then also they have an adsorbed hydrocarbon around them that attracts all sorts of different species. So you get sulfate species, you get more hydrocarbons, you get heavy metals. So when you inhale one particle just like this, you're not only getting the carbon, you're getting the carbon, the hydrocarbons, and all the species that is associated with it. But we don't inhale only one particle, we inhale a lot of concentration of these particles that come from fossil fuel combustion. So there has been a lot of research on the effects, the health effects of these particulate matter. So when we look at the toxicology or the pathophysiology, how this affects health, and these studies have been done in human and in animal studies, and we've seen a long list of things that are bad: oxidative stress, pulmonary and systemic inflammation, genotoxicity, the list goes on and on and on. And these things here in this box, they manifest into health effects. And the outcomes that I outlined here are the ones that have been studied by epidemiological studies. Some of them, I mean, there might be others that we did not even study yet, but these are serious ones: heart attacks, asthma, blood pressure, stroke, impaired lung function, arrhythmia, lung cancer. I also want to highlight this: low birth weight, preterm birth, small gestational age. All these are health effects have been associated with particulate matter. But we cannot not talk about climate change as well without talking about extreme heat. And we've seen an increase in frequency, we've seen an increase in magnitude and duration of heat waves. And the body, when it responds to heat, also has a lot of physiological changes. So we're talking about an effect on a decreased stroke volume, dehydration, a cardiovascular strain. We also see increased heart rate, drop in low blood pressure, vasodilation, could lead to critical organ failures. This has also been linked to health outcomes, mainly cardiovascular diseases, respiratory diseases, and other diseases like kidney, diabetes, has been linked to mental health and allergies. But there's one thing that I want to bring to attention with the panel here and probably with our audience, which is this outcome: it's mortality. And mortality is a very important outcome because it's the worst that you can get, but it's also very attractive in epidemiology because it's somewhat easier to ascertain, because you're either dead or you're not dead. But if you're trying to get an outcome that is somewhat different, then it's kind of hard to ascertain. So what are the studies that have been focusing on mortality and air pollution or heat? And one group of network that has been a collaborative network is the multi-country, multi-city, the MCC network, which I am part of. We have data from 700 cities, more than 40 countries, and about like 70 investigators from all these different countries. Now, I encourage everyone to look into the work that has been done by the MCC network, because the problem with previous studies in air pollution is that they've been done in separate cities around the world. And good luck trying to just link everything and just put them, studies use different study designs, others use different outcomes. But with this amount of data that we have, we can use unified protocol, unified analysis with all this data that has millions of deaths. Two papers I want to highlight really quickly. Particulate pollution mortality paper, this was in 2019. A 10 microgram per cubic meter increase in PM2.5 increased all-cause mortality, cardiovascular mortality, and respiratory mortality. What's of interest is the exposure response, this curve between PM2.5 and mortality. And good luck if you try to find a threshold where you can say anything below that threshold is considered safe for you to inhale the concentration of PM2.5, because I cannot see that from this graph. The climate change induced heat paper as well showed that 37% of heat-related deaths were attributed to anthropogenic climate change. So I'm just going to wrap up and finish with this slide really quickly here. There are epidemiological gaps in areas where environmental exposures are already at extreme magnitudes. So I showed the map of the cities that contributed to these big studies that have unified protocols studying the effects of air pollution and heat. But you can see Africa, Middle East, and Southeast Asia, there is a lot of, chronic underrepresentation of the data from there. But we know that the exposures in these areas are quite at the extreme magnitude. We've seen air pollution in Kuwait City or in Delhi, or we even look into the future projections of temperatures in the Arabian Peninsula, and there have been questions on inhabitability actually by the end of the century with the extreme heat there. And with that, I'll stop my screen, and thank you so much.